Hi, my name is Ian Harris. This is a video to educate nursing staff on the Australian rotator cuff trial, also called the ARC trial. This is aimed primarily at theatre staff, but is also relevant to recovery ward staff and orthopaedic ward or day surgery unit staff as well. The background to this is that the best available evidence that we have on rotator cuff repairs for degenerative tears comes out of a Cochrane review which summarised all of the randomised trials comparing rotator cuff repair to non-operative treatment, showing that there is actually little evidence supporting this surgery and that it may not provide a significant benefit to patients compared to non-operative treatment. Yet despite this, this operation remains very common and it's actually becoming more common. So we feel it's important to do a definitive trial, a very high quality trial, and that means a trial where patients are blinded. And that's what this trial is. So it's a placebo-controlled trial, or it's a surgical trial that involves two arms. One is where patients get a rotator cuff repair, and the other is where they do not get a rotator cuff repair. But patients are blinded as to what they receive, and so are all of the treating doctors, nurses, physios, and researchers that they will see afterwards. The aim of the study is to determine the effectiveness, safety, and cost effectiveness of arthroscopic rotator cuff repair. This is a procedure that's mainly done arthroscopically these days, so we're not looking at open repair. And we're comparing this to arthroscopic surgery without repair and seeing how it affects their shoulder pain, function, and quality of life, and also complications. These are the surgeons that will be operating, the shoulder surgeons that are going to be treating patients, and these are the hospitals where they will be treating them. The design of the study is that there's two arms to the study, a rotator cuff repair arm and a no repair arm, and patients will be selected because they're aged between 45 and 75 and have a proven degenerative rotator cuff tear. Now, interestingly, the consent needs to be described here because all patients will be consenting to the study, but they'll also be providing the usual surgical consent. Now, the consent to the study says that they're aware that they have a 50-50 chance of receiving a rotator cuff repair or no repair, and patients will also understand that they are to remain blinded, and they will realise the importance of not being told or not trying to find out what treatment they had. So the study's been approved by ethics. All patients will have signed onto the study before they get to the hospital, but they also sign a special consent form for the surgery, and that doesn't say exactly what they're going to have, and it says what's quoted here, which is arthroscopic surgery, etc., as indicated according to the ARC protocol, and that's the ethics approved way of wording the consent form. So you'll see that on their consent form as they go through theatres. And this is what happens. We consent them for the study and consent them for surgery before you see them, before they arrive in hospital. And then they go to surgery, but they don't get randomized until they're in the operating room under anesthetic and having an arthroscopy. And that's because we want them to be blinded, but it's also because the surgeons need to confirm that the patients are eligible. So the cuff tear, for example, needs to be a certain size. It needs to be between 1 and 4 centimeters. It needs to be a complete tear. And so once the surgeon has confirmed that, then they'll randomize them in theatres, and the patient will either be left alone, like that top picture, or have their cuff repaired. The randomization occurs online, and that will most likely be done by the anaesthetist. It's important, though, even though everyone in the operating room will know what treatment the patient had, of course, because they'll be doing the surgery or not doing the surgery, that they not discuss this outside of the theatre to anyone. It's very important. The post-op report that goes in the medical record will not reveal what they had. So again, the wording of the operation report, even though it'll have all the other routine things like, standard incisions, post-op obs, all the usual things, the procedure will say that it was done according to the ARC protocol. There will be a copy of an operation report explaining what they had done, but that will be kept by the surgeon, and we keep that along with any images in a separate file. So it's also important that the images that we print out go to the surgeon and they do not go to the patient, because if they get a picture, obviously, of their rotator cuff repair, they'll know what's going on. And recovery and ward staff must also be blinded, so ideally you will not know what the patient had, you'll just know that they had arthroscopic surgery to their shoulder, and it's important the theatre staff don't tell you and that you don't try and find out. And as I said before, the patients understand that they're not to be told. We will arrange study materials for the patients. So, for example, we're going to send a letter to their GP so they understand about the study and not to do scans on the patient, for example. And we send a letter to the physios. We give an exercise pamphlet to the patients, and the physios also receive a comprehensive guideline booklet explaining the stages, because all of the patients will be treated the same. They all get exactly the same physio in both groups of the study, both arms of the study. So finally, just contact details. So Ian Harris, that's me. I'm the lead investigator. I'm Professor of Orthopaedic Surgery at UNSW, and I can be contacted on that email and that number. And Nancy is the project coordinator, and she does a lot of the liaising with sites, and that's her email there. So please feel free to contact us whenever you like. Thanks very much.